Good afternoon and welcome to Employment for All. My name is Kimberly Bissett and I'm an Employment and Training Manager at the Boston University Center for Psychiatric Rehabilitation. Our show is brought to you today by Blue Cross Blue Shield of Massachusetts. The goal of our show is to bring you informative and supportive resources to help connect you better with your community, help your overall well-being, and really promote your career development. And today is no exception. I'd like to welcome two of our guests who are very involved in the youth initiative here in Massachusetts, Ann Capoccia and Matthew McWade. Welcome.
Hi.
Thank you, Kim.
Thank you for being here. So let's start out a little bit with Ann. Tell us about yourself.
Well, I work with the Department of Mental Health with the Child Adolescent Division, and I'm involved with a lot of interagency activities with other agencies like Department of Education, Department of Public Health, and I've really been interested in specific populations, early childhood, homeless, folks who have been marginalized, and this has brought me to the Transition Age Youth Initiative. Looking at that population.
Terrific, terrific. And Matthew, tell us a little bit about yourself.
Well, first of all, I'm a consumer. I was diagnosed at 12, and around the age of 22, 23, I started working as a mentor in the peer field, and now I work with Ann, kind of ensuring youth consumers a voice, whether it be to the general public, other consumers, providers, the system, just generally giving them a venue to voice themselves, whether they have something specific or just finding opportunities for them.
Terrific. And you're the statewide youth council youth coordinator,
yeah.
Which was actually a brainchild of Ann's. But the position is really designed to help give a voice to young adults
Exactly,
who experience psychiatric disability. And that is so important because we all understand that the person, the individual, knows best about how to promote their own recovery, and they just need to be connected up to the right resources about that. So tell us how DMH got involved with the youth initiative.
Well, about 5 years ago, a study was conducted by the State Mental Health Planning Council to look at outcomes for young adults. We have children and adolescents who go through all of our systems, and as they reach age 18, they really have not remained connected, nor have they gone on to college, they haven't graduated from high school. They have had really a difficult time finding housing, employment, and really getting established. A lot have been involved with our system later on, have substance abuse problems, and it's been very difficult for them. So we decided to put together a youth development committee made up of advocates and research people and try to look at what did young adults really need and set up a bunch of programs that really responded to the age.
Okay. And really because they were kind of caught in between. There's a youth system that's very responsive, and there's an adult system, but the young adults really aren't sure, and they're in a different field. They're in a different kind of space than the people who are older and experienced in services. So this was really dedicated some time, some money, some energy, and some efforts to really help the outcomes of youth, which with psychiatric disabilities are really, the dropout rates are high, the substance abuse rates are very high, and the homelessness rates are high, so to try and turn that around. And
we really found that the programs that were already established, child programs, adult programs, are not where young adults want to be.
No, they feel very disconnected, disenfranchised from them.
Exactly. So we had to learn what was it that young adults really wanted, and the way we learned was to start to ask them, you tell us what exactly you want and what exactly you need. And that really led us, I think, to your story, Matt, and to what you are about, because there's a lot of disconnect that has happened, I think, in the systems around listening and being able to then translate that into programs. So Matt and young adults have really helped us think about that.
Terrific. So I think that leads us, Matt, to you in terms of, can you tell us a little bit about, you have a unique story that led you into this work and up to the point where you became a peer mentor. Can you speak to that a little bit?
Well, basically everything in my recovery process since I was diagnosed till now has been of extreme use in this work. I was diagnosed around 12, 13 years old. Eventually I came out of school in 8th grade. It was just far too difficult. After a couple of tries at some different schools, I eventually found a school that worked for me in Brookline. Beacon High School was really good, and I got through high school. I went into college, and then my symptoms started to get worse. Originally I had a lot of phobias and things like that. I was drug addicted, and then I started experiencing paranoid schizophrenia. And it was just an extremely confusing time. like 2 years of hospitalizations in a 3-year period. And then, thank God for TASE services. They were already kind of up and running as an experiment in the metro suburban area. It's around Boston, like from coast to coast around Boston, but not in Boston. And they've had them for a little while. So I ended up getting a TASE case manager. I was in a specific TASE residential. I used some other services, but the TASE services really, really enhanced my recovery, because some of the aspects of those supports and services that people need, it ends up kind of alienating you from the age you're in, because you're with older people. It's just, you know, being with people my own age, it was almost like I was in a college dorm or something, but we all had a diagnosis. It didn't really matter. It was kind of a side thing, but it was completely accepted in that environment. And that really made me it helped me plant the first seeds of being able to get past my diagnosis as a negative thing, is something that I had to be ashamed of. And eventually I moved into a mentoring position, which was my first experience working as a consumer provider.
Okay. Let's take a step back and say, let's speak a little bit to TAY's Transitional Age Youth Services.
Yes.
Maybe, Ann, you could speak to a little bit of their importance, how important they are.
The first thing we did with this Youth Development Committee, we took the committee and we said, we need some help. We got a consultant, and the consultant said, you need to put together a strategic plan, and you need to think about a series of recommendations to get to the commissioner, which we did. And we had the young adults that were at that time on our Youth Development Committee present to the commissioner what the issues were. And from those issues, the commissioner went to the legislature, got funding, and we were able to develop the services. The first service that we created in all our areas, our 6 DMH areas, was Transition Age Youth Case Management. Okay. That young adults need case managers who understand and are committed to this age population. Preferably someone of the same age, but it doesn't preclude other people being able to work with the population. You just have to understand and be committed. The second piece was that we really needed to create youth councils in all the areas so that young adults could talk to each other. There then needed to be a menu of services, wraparound programming, peer mentoring, which Matt was a peer mentor. We needed to have housing, employment, education, and vocational training that was specifically designed for young adults.
To take the whole young adult into consideration,
Right.
to really focus
For
on
what
all
they
the needs.
need and how they need to have it created. And it's very different from the way other people will tell you.
Yes.
And I think we've had experts, Rusty Clark and Marianne Davis, come and work with us around really listening to what young adults have to say about how small is better, how one-to-one is better, how you need to break up the day, how you really don't do things the way we're constructed at this time.